Hi, and welcome to today's webinar hosted by eLotus, your leading provider of acupuncture continuing education. I'm Donna Chow, your host and moderator for this exciting class. For over 2 decades, eLotus has been organizing continuing educational seminar, and today's session is truly exceptional. We have the privilege of being joined by one of the most esteemed Chinese acupuncturists in the country. This master practitioner is over 80 years old, boasting a remarkable 50 years of clinical experience. With a rich background of studying under numerous masters, he is eagerly looking forward to sharing his vast knowledge on achieving the best results with acupuncture. Today's class, Ashi points for nerve pain, master lessons of over 50 years, will be presented by the esteemed Dr. Kai-Fong Tiu. The class will be from 9 a.m. to 1 p.m. Pacific time with a short break right in the middle. Before we delve into the class content, let's go over some important details regarding the chat room, questions for Dr. Tiu, and the CEU quiz. In the chat room, please set your chat preference to everyone so that all attendees can engage in the conversation. For questions to Dr. Tiu, please kindly type them into the Q&A box. And finally, the CEU quiz. It will be available on the following workday, and we'll email you guys when it's available. We'll also be sharing an exclusive eLotus Gold Pass offer to you today. It's your ticket to an unparalleled learning experience featuring expertise from over 200 eLotus speakers, spanning topics like Master Dong's acupuncture, Dr. Tan's balance method, Chinese acupuncture, Japanese acupuncture, and more. With over 3,000 hours of webinar recordings to elevate your patient care. Normally priced at $1,500, today we have a special offer for you. Get the eLotus Gold Pass at just $999, and our sponsor, Evergreen Herbs, will give you that same amount back as a store voucher to explore their premium herbal products. This means unlimited CEUs, over 3,000 hours of video recordings, and almost $1,000 worth of Evergreen Herbs, making it an ideal opportunity for both newcomers and experienced herbal practitioners. If you're currently a Gold Pass member or use Evergreen Herbs, please share in the chat how you've benefited from the Gold Pass and how you feel about the efficacy of Evergreen Herbs for your patients. Our speaker today is a highly skilled Dr. Tiu, renowned for his specialization in treating sports injuries and musculoskeletal traumas. With over 5 decades of experience, his patients often experience immediate relief and swift recovery from pain. Dr. Tiu's previously served as a professor at the Chinese Academy of Traditional Chinese Medicine, Orthopedics, and Traumatology, and is a distinguished member of the Chinese Pain Society. Today's class will be a unique experience as Dr. Tiu will deliver his teachings in Chinese with Tina Chen providing English translation. This format will mimic the experience of studying at a TCM hospital in China, where you can observe everything the teacher does in the clinic with the aid of a translator. Unlike some TCM practitioners who guard their knowledge, Dr. Tiu is eager to share everything he knows, aligning with our vision of spreading TCM to the Western world. As he speaks slowly and faces some hearing challenges due to his age, we kindly request your patience. Throughout the class, he will generously share the essence of acupuncture, offering pearls of wisdom and practical demonstrations so that you can witness and learn precisely how to achieve immediate results. Don't be afraid to ask questions because there are no silly questions. The more that we ask, the more that we can learn from Dr. Tiu's 50 years of wisdom. Let's embark on this enriching journey together with Dr. Tiu and Tina Chen. Get ready to gain invaluable insights into the art of acupuncture and elevate your practice to new heights. Thank you for being part of this extraordinary event.
Good morning, everyone. Can you hear me? If you can, please type yes into the chat room. Good. Thank you. Well, welcome to today's class. Can you type into the chat room if you have been to at least one of Dr. Tiu's class before and have tried his technique in your practice? Can you put in the number 1 in the chat room so I can take a look? How many people have already gotten the idea and tried it in the clinic? Very good. 1+, good. So if you've tried his technique in class and it has worked well, good job. if you have questions and it's not working as well as you think it should, like the result that you're seeing in class, write down your questions so that you can ask him, today or in the next class, so that, you can figure it out. What exactly is it that you did wrong so that you can improve to try to get to his treatment result, okay? And if you're new to his class today, can you put in new into the chat room, and then can you let us know how did you hear about this class? And you're finally coming. It's been 10 months. We've waited for you for this long. So yeah, let me see. I think I saw a bunch of new people today. So that's wonderful. Okay. Good. So if you're new and you like today's class, you might want to consider the Gold Pass that Donna was talking about, because you can review and watch all of his past classes that we've had every single month for this year for free. And that's all included in the Gold Pass, along with, I don't know, some 300 some classes for the past 10, 15 years of courses that we've held. You can watch all those videos for free and get unlimited CEUs. And then you'll get the herbs too from Evergreen from us, who will give you a voucher for the Gold Pass value. So something to think about if you're more serious about learning. What else? So in the first half an hour, I'm going to go over some of the tips and essence of Ashi point needling. And then from there on, we're going to do demos. And Dr. Dell will show us, exactly what he does in his clinic and also live here. And then Sam will zoom in, and then so you can watch closely and watch his hands at work, because if you haven't been here before, we'll go over that in a bit, that he says the needling hand is not as important as the palpation hand. So, all right, let's dive right into the lecture notes and then get started, okay? All right, here's our star. 来，请坐。坐这边，这边。Okay. Okay. So I'll do the overview first, and then we'll do the demo, and then the Q&A. So if you have any questions, please put it in the Q&A chat, so then it doesn't get lost in the chat room, okay? So there are many different styles. You are free to choose whatever style that appeals to you the most. They all work. It's like all different types of Kung Fu. This style is what Dr. Dell has found to be most effective, because he has gone through what we are going through, which is learning from different masters and different styles. And he feels like this Ashi needling is the most effective and easiest, because it just involves your sensitivity of the fingers in identifying exactly where's the problem, and then mastering the technique of needling through that Ashi point to get the best result. So here are some of the tips, okay? Number one, you need to ask the patient to identify the most painful area. That I think it's obvious because it's Ashi point needling, right? Second is you need to palpate for hardness or cord. So this is a little bit harder. If you're a beginner, like I was in his clinic in the beginning, I couldn't feel any knot or anything. It just feels pretty much all the same. But if you concentrate and maybe sometimes close your eyes or palpate from light to hard, you will be able to find that specific area of the muscle where you have a knot or cord or something that is different than the rest of the tissues. So that is the Ashi point, okay? So he said when you're needling, you would take your left hand to palpate, and whatever it is, the hardness that you feel, hold it, and then needle right through it. See, it's very important here that he says to not let go of this hand, the left hand. I'm right-handed, so don't let go of the left hand or where you feel the knot, because the tendons are slippery, he says. If you let go and go grab your needles and come back, you might lose that point. So you want to hold it in place, needle into it, through it, and then get the deqi sensation. So we're looking for that feeling of tenderness and swelling and, the deqi sensation in order for it to work. If the needle feels like you're inserting through tofu, then the treatment is not going to be effective. All right. Next. Right here. Somebody asked before, so if I don't feel any knots, should I just needle the point where there is pain? He says, no, you need to expand the area and try to find the knot, because the area of pain may sometimes not be the area of the problem. Okay. So you need to expand the area. Number two, the needling hand is not as important as the other hand that is stabilizing the the point, especially if you have to needle into a tendon. I think the last class we had a few cases, one or two, that had a tendon that feels what Donna calls crunchy. So this is when you are palpating the tendon. I don't know, for lack of a better word, crunchy is a good description. It feels like the tendon is stiff, and then you can almost palpate it like a cord. So in that case, you need to hold it with the left hand and then needle right into that. Okay. Number 3, Dr. Dell uses gauge 30, so it's relatively thick, the needle, because he wants to achieve that strong sensation. You could use a thinner needle if the patient is very sensitive. Some patients don't want that much pain, so they just basically have to come back for a couple more treatments. But usually they visit him 1 or 2 treatments, and that's about it for pain. Number 4, he wears gloves when you're palpating, or when he's palpating, and then when he's needling. Sometimes when he extracts the needle, blood will come out, so he's always wearing gloves. Number 5, now use as many needles as necessary to relieve the hardness and the pain. So what I'm saying about the hardness is when you palpate the Ashi spot, that's hard. After you needle it and needle a few other spots that you feel the knots, when you take out all the needles, if you feel more knots, he will go ahead and needle again, the secondary points. So he will treat the primary area of pain and then the secondary after. So you can use as many needles as you need to. I've seen him use up to about 20 needles. All right, here is what I was talking about. Work on the primary area, and then the secondary area. Okay, so this one I talked about too. The dirty sensation is important. You need to go through the knot, not just to touch the knot. Like, for example, if this is the skin and here's the knot, right? And then you're palpating, right? You feel it. And then when your needle goes in, you don't stop here. You want to go through it like this, so that you break up the, whatever it is, adhesion or knot or anything that is causing the stagnation. Number 8, when the patients are very sensitive to pain, what he does is he'll do cupping first and then bloodletting so that the area is desensitized. So then later you can needle and they won't feel as much pain. So that is a good tip if you have patients who are afraid of needles. All right, and number 9, do you leave the needles in? He says you don't need to, as long as you get the sensation, the swelling sensation, the distended sensation. You don't have to leave the needles in. And he's very honest and open and tells us that you could need to leave it in because patient usually will get some good rest in your treatment room. And then if they fall asleep, the treatment is even better. But usually he will leave them in the room like that, or the needles like that, more so for the patient to psychologically feel that they're getting their money's worth, you know. I don't know how much you guys all charge for acupuncture, but you know, patient, sometimes it's a funny psychology. If you can treat their problem with 1 or 2 needles, they'll feel like, oh, great, I got the relief. But then they feel like, you know, they didn't get their money worth. I don't know what it is. They would rather have more needles, I guess, in a longer period of time for the treatment session. Okay, number 10, inform the patient. This is a very important point, that unlike the other acupuncture methods, sometimes, you know, there's immediate relief, but then the pain comes back within a couple hours or the next day, then they have to come back. But this technique is very different because he is really working on that area hard, right? With bloodletting and with a very thick needle. So what will happen is the patients, I feel like the area is going to be inflamed and it's being treated. So then he says the patient will feel more pain or the same level of pain for a few more hours or maximum a day later. And then the pain will just decrease. So it's not going to return, basically. And if it does, it is generally a very difficult case and they may need to come back. But for most of the time, they don't need to. 1 treatment is enough. Okay, so this is very important to get across to your patient if you're using this style. Otherwise, they'll feel like you made them worse. It's very much like using blood movers, a very strong blood moving formula. I always tell my patients, some patients may experience exacerbation of symptoms. just because we're breaking up the blood stasis, right? Kind of like you're remodeling the vessel, remodeling a house, the vessel is being rearranged, and then all the clots are being pushed out, then it's going to be a mess, right? So they might experience more pain. And that happens a lot when they have had a past trauma. So with some dead blood in the brain or in the head area or whatever. So blood movers is going to do that. One time we had a teacher called Dr. Liao who came from Taiwan to talk about cancer and other, very popular disorders. And he was the one who introduced Xi Honghua to us, which is saffron. So in that class, he said that, he would soak 20 grams of saffron into gin, and that is very, very good to prevent angina and any kind of cardiovascular disease or to move blood, because it is one of the strongest blood movers. This is not regular Honghua, okay? This is Xi Honghua saffron. So it's the one that you would find at Costco for like $10 or $8 for 1 gram. It's very expensive. So what we did was we experimented with that. Everybody at the office, my family and friends, I gave it all to them. And one of the guy who drank, he instructed to drink 1 shot every night. And one of the guy had the next day bleeding in the eyes. One of the vessel popped because he used to be in the football team when he was in high school. And just drinking that 1 shot of saffron gin made his blood vessel pop in the head. So then he was really scared, the next day not to drive. So this is what I mean, kind of like this. So if you know that you're moving so much blood and doing a very aggressive treatment, the effect that you should expect is something that the patient might feel uncomfortable with or scared about, you need to warn them ahead of time. All right, just like this one. Okay, next tip. On August 31st, somebody asked this great question. What if the area of pain cannot be needle, like the pain in the eyes or scrotum? What do you do, So Dr. Dao said, then you need to palpate around the area for the Ashi point. Somebody asked on September 28th that, does he use a TDP lamp? He does not, but if he says it's comfortable, he does use it, but he says it's not necessary. He does have it in his clinic, but he doesn't usually use it unless he feels like the patient is going to take a rest. And then he says the patient does feel comfortable and they do well feel like they got their money worth for the treatment. Okay. Somebody else also asked in September, does he use electrostim? He does not use electrostim. In today's class, you will see him when he does the demo that after he inserts the needle, he will press on the tissues next to the needles. In the beginning, he didn't explain why. In his clinic, when I saw him do that, I was thinking, wow, why would he do that? That would cause more pain on the patient. But later he told me that it's because he is providing more stimulation. So just pushing on the local tissues simulates the same effect as if you were to twirl or stimulate the needles. Okay, next, contraindications of Ashi point needling. One is pregnancy. So if they're pregnant, be careful for the points on the back. And also if they are 8 months or more, don't needle. And number 2, the thoracic points. You could easily cause pneumothorax, so then you should be careful, he says. Don't do it. I think it was class 2 or 3 where he actually told us not to do it, or beginners not to do it. Then I asked him, well, if we never do it, how would we ever learn how to do it? So then he showed us how to do it properly. I think that was class 2 or 3. I don't remember which class that was. Okay, now when to bleed. So he says when there's no obvious pain or not, then you do the bloodletting first. Because there are some people, some patients, they say they have pain, but they cannot exactly pinpoint where. So what you would do is then you would just bloodlet in that general area and afterwards palpate because the knot will come out. Some of the other tips include use disposable cups. And what he does, he sells the cups to the patient. So after the bloodletting, the patient brings them home and cleans it themselves and then bring it again to the next treatment, if there is a next treatment or for the future. And make sure you wear gloves. That's very important. And then you follow the proper bloodletting protocol so that we don't contaminate and then everybody's safe. Okay, so when he's bloodletting, doing the wet cupping, he will generally poke 3 to 5 holes. That usually is enough. But if you're dealing with very severe pain, you want to poke more. So he is doing the lancet. He'll show you the lancet later. I'll include a link for the lancet needle that you can get on Amazon or from any of the suppliers. It's just a regular lancet pen without the cap. So he usually does 10 to 20 pokes because most of the patients who come to him are very desperate and very severe. But if their pain is not that bad, you don't need to be that aggressive in letting out blood. Okay, here's another tip. He says that if the case is severe, you want to cup first and then needle, okay? And if it's not that bad, you can just needle. And if that's effective, great. If it's not, then you go and do your wet cupping. Another tip, he says, don't shower for 12 hours or bathe. And then you don't need to put any ointment, onto the point that you have bloodlet. You'll see how this works when he starts doing the demo. And then on areas you cannot needle or bloodlet, it's better to just needle. So if you cannot, for example, the back, the fingers, you just, it's hard to needle, you can just bloodlet. And when he does the fingers, I think he did it in the last class. And did he do it in the last class? No, he didn't do it in the last class. Last class, we did carpal tunnel and another trigger finger, but we needle on the elbow. There was one class, I think class 4 or 5, he had a patient with arthritis of the hand. So he did bleeding, bloodletting. So he would be squeezing the blood from the joints. Okay, next one. Here's a tip. You can remember this. When you're treating acute pain, bleed first, needle second. If you're treating chronic pain, needle first, then bleed after if necessary. If you haven't gotten rid of the pain, then you can bleed. Now, my question for you, if you can type the answer into the chat room. If you have a chronic case with acute exacerbation, would you needle first or would you bleed first? Can you put that into the chat room? What would you do? A chronic case with acute exacerbation. Do you treat it as an acute case or a chronic case? Some people say bleed first. Some people say needle first, acute first. Okay, I'm going to ask Dr. Liao. I have my answer, but let's just confirm. 廖医师，如果有一个慢性的痛，然后现在是变成急性了，这样子的话是先针还是先放血？
假如痛了厉害，先放血了，它没有那么痛。
对 ，OK. He said, if it's very painful, then bleed first. So if it's the conclusion is, even if it's a chronic condition, if there is an acute exacerbation when it's really painful, then always bleed first. Needle second, okay? Okay, let's see. In August, he had a little pro tip here. For acute pain, the more blood you let out, the faster the relief. You can do bloodletting twice in the same area. So we saw that in that class where he bled and then he needled and then he bled again because, the pain was really bad. So you can bleed again in the same area because you will be poking different holes and then still letting out more blood. And then somebody also asked in that class, if you are sucking so hard, will the patient keep bleeding and bleeding and bleeding nonstop? Because I have seen him bleed like half a cup to 3/4 of a cup. That's a lot of blood. So, you might get scared in the beginning if that's too much blood or if it's ever going to stop. So he said that, bleeding will be minimal or none once the stagnated blood has been let out, which means that whatever it is we're pulling with the pressure from the cup, it's just going to be what is stuck. When the body has normalized, the tissue has normalized underneath, there won't be any more blood coming out. So you don't have to worry about, the bleeding is going to continue. Okay. Next tip. In class 3, we saw some patients with no specific area of pain. In such cases, don't retain the needles. Oh yeah, that was a very strange patient. She just said, I have pain everywhere, but nowhere. So what he did was he needled in very various different places, and then just take out the needle and take out the needle. He would leave it, stick it in and take it out. He wouldn't even leave it in to get the chi sensation, not for very long. So for this kind of cases, you want a needle, take it out, a needle, take it out, and repeat. I think you're just going for the stimulation because the patient really, cannot feel exactly where is the problem. All right, so somebody asked in August, how long is a session of bloodletting? So generally 5 to 10 minutes or until the blood congeals. So this is a very important and very good pro tip because when you're doing wet cupping, if you take it out too fast, you didn't get enough blood out and the blood is still running. So it's very messy when you remove the cup. If you leave it too long and the whole area is purple, then you are creating more stagnation. So that's no good. So what you want to do, the general time that is a good time to remove the cup is when you look at it and it looks like the blood has turned like jelly or jello. That's when it's a good time to take it out because it will be very easy. The cup is like this. Here's the skin. So you would remove the cup, and because it's solidified, you can easily scoop the blood, the jello, into the cup and then clean it up like this. So he will show you how to do that. I'm sure somebody will be bloodlet today. Next slide. How do we control the amount of blood being sucked out of the cup? Okay, so this was from the class in August. This is a very good question. The first way to control it is the depth of the lancet needling. Now, he's using the lancet pen without the cap. So the purpose of the cap is really the cap is, I don't know if you can see, but the cap controls the depth of the needling each time because the cap is touching the skin, right? So then every time you click onto the lancet pen, only a certain amount, I don't know, maybe like 3 millimeters or 4 millimeters that will go into the skin. However, he has removed the cap. That means is to prevent the cross-contamination of the cap touching the skin, right? Which means the lancet needle actually is free to enter deep into the skin. So this is when your hand needs to be really steady. So when you're going across the area to bloodlet, you don't, your hands shouldn't be higher at some point and lower at some point because some holes will be deeper than others. So that's number one, the depth of lancet needling. You want to make sure your hand is always steady in the same distance from the skin. Number two, the number of pokes, right? I talked about it earlier. You do 10, sometimes 12, 15. So the more severe the condition, the more times you would use the lancet poking because we're trying to let out more blood. Number three is number of pumps, right? When you're doing the suction cup, it's like 4 or 5 or 6 times. Depends on the skin of the patient. Some people's skin are tighter than others. Some are looser. So the general idea is when you see that the patient's skin is sucked to fill about 1/3 or half of the cup, or when you see that the skin has already turned purple is when you would stop. So one or the other, okay? And then number 4, the length of time. When do you, take out the cup? So pretty much until when the blood congeals, you would take it out. So those are very important points on how much blood to let out and the general tip on bloodletting. Another one, we saw this in one class. I think it was the last class or the one before where we saw bubbles in the cup, with the blood. And people ask Dr. Diao what that means. And it doesn't mean anything, extravagant. It's just bubbles from leakage of air into the suction cup. So that means your suction cup, didn't cup onto the skin tight enough. So air leaked in, and that's why the bubbles. How do you bleed the extremities, the toes and the fingers? So he said, bleed the most painful joint first. Second, bleed the area that is swollen around it. And then let the blood flow out naturally. If it doesn't happen, then you need to squeeze out the blood. It's pretty self-explanatory. What does it mean when the cups look misty? That just means there's water vapor. If you want to see what that looks like, you can go onto my Facebook page. I posted some of these pictures of what that looks like. It just looks like there's mist around the cup. And that means the patient has dampness in the body. In the last class, we had a really skinny patient who had this. She doesn't look like one of those chubby patients with dampness. But so we asked, does she eat sugar? Does she like to eat dairy? And she says, no. She just says she drinks everything cold. All the beverages were cold. And I remember, oh, yeah. That's why, she has the dampness. All right, next. So contraindications, patients who are on blood thinners and diabetic patients. He still does perform the bloodletting if the pain is severe, but if the pain is not so bad, then you don't need to do it, okay? So that's it on the introduction. This is like a very concise summary of all his experience in his past 50 years of practice. And I put it in a way where it's just bullet points, but later on, as you start to dive deeper into this method, you'll have a lot of questions, and then you can always go back to the notes to find the answers. Okay, so let's take a 5 minutes break. We'll prepare for our first demo. And if you have any questions, please put it in the Q&A section. And when we have time, we'll come back to answer your questions. All right, let's do a 5 minutes break. Thank you. 好，我们休息5分钟。